For those of you just now joining us, this is council time for Wednesday, March 9th at 9:54 a.m. And we welcome you, and we begin with old business. Is there a motion for approval of the minutes of March 2nd?
Move to approve.
I'll second it.
It's been moved and seconded for approval of the minutes of March 2. All those in favor, please signify by saying aye.
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 And there are none opposed, so the motion is passed. And we next move to the Ethics Ordinance. Is this going to be Lindsay who presents?
Yes, so this is just bringing back the ordinance from the last two council meetings that I believe Lindsay has incorporated some of the suggested changes, but I'll let her summarize what those are. Thanks.
Yeah, so this just incorporates the changes that we discussed at the last council time meeting. Leslie's also reviewed this and didn't have any additional changes. So happy to answer questions, but I think the real question for the council is this ready for moving on to hearing? There's no changes that were not discussed within the council meeting last week.
Are there comments from council, please?
Chair. Yeah, I just wanted to
Yes,
touch base.
Councilor Olson.
Thank you. Yeah, I just did my focus interview the other day, and I did get the question kind of as to why the council sort of took out a lot of the language that we looked at the first time. And I just, want people to know that as we refer to the RCW and we refer to our HR policy, that there is a lot of meat in those two documents, which is where that will be falling. And that because we took out a lot of the other language, it doesn't mean that this is toothless or meaningless. And so I just want people to understand that that we're taking this very seriously, and that we do believe there is significant language that supports ethical behavior, and that we're trying to delineate between conduct and maybe things that elected people say and do that others might not like, but may not rise to the level of ethical conduct. So I just wanted to make that clear and get that on the record as we have this conversation.
I certainly concur with what you just said, Councilor Olson, and I would add that in comparing this ordinance to the charter amendment that was passed by Clark County voters, it appears to be right in line, which is important, and I think that has been accomplished well. Councilor Medvigi, you have the floor if you wish to comment.
Thank you. So the first round of this, when we first started getting a few complaints, we realized how scant, skimpy, ineffective all the holes that were in the existing mechanism for considering those complaints, that it was completely unworkable. And I think even at that time, I had held up my judicial code of ethics, which is a tome from the state of California. I mean, these are very complicated and detailed areas, and no amount of legislating will be able to fill every hole and account for every possible future occurrence. This is our best effort to streamline it. I appreciate Councilor Olson's comments, as well as the chair's. We are trying to come up with something that is workable at our level, considering the size of our county and 5 councilors once we get back to a full board. I mean, we are not a full legislative body of hundreds, and nor do we want to create a tome of ethical language and processes and procedures. This is our best attempt to incorporate what was passed by the voters and to massage what we had already been working on and working with over the past couple of years. So obviously we'll have to adjust as we move forward, as we do appoint a committee and they start doing their work. Hopefully it won't be very often, but we do in fact have one sitting complaint right now that we still need to deal with. So in any case, it may not be perfect, but it's a lot better than it was, and I'm hoping we can adopt it.
Kathleen, or Lindsay, does this need to move to public hearing?
Yes.
And we're looking at April 5th for the public hearing date.
April
for now.
5th?
Yes.
Okay. Do I hear a motion from council?
Motion to approve, moving it to a public hearing, and obviously we'll continue to edit through that process.
Second, but did I hear you say we're going to continue to edit, or is this the document we're moving toward public hearing?
No, well, I'm sorry, I didn't mean to be misconstrued, but that's part of the public hearing, is to consider any last minute changes. So I'm not making any further changes to this document. This is the
Okay, all right,
document.
so, yeah, I'll second then that we're moving this document to public hearing for consideration.
Further comment? All those in favor, please signify by saying aye.
Aye.
Aye. The motion is passed and the ethics ordinance will move to public hearing on April 5. Thank you, Lindsay and Kathleen. And now to the 1406 sales tax funding, which we talked about and heard about in excellent detail last week. Lindsay?
Yeah, so just a quick update for you, although we'll have more next week. So just in follow-up to Roy and Vanessa's discussion that we had last week. So what we're planning on moving forward with is VHA will be coming in to make a request for the 1406 funding at least through 2023. And so that request will come to council next week for consideration to put that on for approval at a hearing. It doesn't need a public hearing, but would need to go onto a Tuesday agenda. And then also looking at 1033 in the mental health sales tax. So what VHA is putting together is a possible kind of two-pronged request for the 1033 funds. One component of that would be for some operational expenses that would go through the RFP process that's done as part of the Mental Health Sales Tax Advisory Board. A second component would be a capital component. They're looking at potentially making a request for their Lincoln Place 2 project, and I'll let Roy give more detail about that project when he comes to council time next week. So that's just the update from our conversation last week, and look forward to more information next week.
Very good. So thank you for the update. And if there are any comments from council, let's receive those, but we don't need to take action on this morning, I don't believe.
Correct.
I did wish to thank Lindsay for her continuing work in this area as we kind of neck down the focus on where this money is both best spent, both the 1406 and the mental health sales tax. This is critical to us in our next steps across the board for the county. So I really appreciate, Lindsay, the work you're doing on this, and I look forward to a great partnership with the Vancouver Housing Authority. It already is a good one. And so I'm hoping we can favorably consider their receipt of some of the 1406 money, if not all of it.
Thank you very much. Any further comments? For lack of any, we'll move to 1.4 on the agenda, rules of procedure. Lindsay?
So this will be coming to you as part of the public hearing next week. Just wanted to let you know that there has been a change since we talked about this last time. The only change is removal of the code of ethics provision. So you'll recall that when the council had been talking about the rules of procedure update, which I know we've been talking about periodically, basically since the COVID-19 pandemic began. But there were discussions about including a code of ethics provision in this, and some sanctions or penalties that could be levied in the event of a council violation of that code of ethics. Given the fact that we are adopting a code of ethics separately as part of the ordinance we just discussed a moment ago, I removed that from the rules of procedure. So that will fully be contemplated within that separate ordinance. So that's the only change. Happy to answer questions, but otherwise this will go before you next Tuesday.
And if I can add, it looks like the first sentence we might need to take out then the code of ethical conduct.
Yes.
Since that'll be a
Yes.
separate ordinance, just to update that. And as Lindsay stated, this will be on next week's hearing. And just as a reminder, the council did suspend the rules of procedure when COVID started to provide flexibility. So You can certainly adopt it. You may want to consider continuing the suspension until the emergency order is lifted from the state, or you can continue it to a date certain or a date uncertain, which would just mean we would have to repost it with the notice to the Columbian. So you do have some options next week during your hearing.
I did receive a question from a constituent, and that is whether or not a counselor is paid for unexcused absences, and particularly for extended unexcused. And I emphasize the unexcused, that's what they were asking about, absences.
Yeah, so there is a state law provision that allows when you have a county elected official who is absent from their duties, but it's more in the sense of they've abandoned their duties for a period of time, and I would need to look at the statute, but I believe it's 30 days or more, that their compensation can be withheld. But it takes the legislative body prosecuting an action or basically filing an action under that state law provision. So it's not an automatic, oh, somebody was gone for 30 days, we're going to withhold their compensation. But there are some state law parameters that allow elected officials to potentially have their compensation removed. But that wasn't something that would be new for the county, that falls under state law. But if somebody's absent, for 1 or 2 meetings, yes, they continue to receive their compensation.
But what they were talking about was extended absences that were unexcused, and not ones that were taken to the courts and in accord with the state law that you're referencing there. But just for the county, they were wondering, say a person is out unexcused for a couple of weeks, and maybe a couple of weeks now and a couple of weeks another time. Is that where they are continued to be paid as if all is well?
Currently, yes, they continue to receive their compensation. Yes.
Mm-hmm. And I guess the question is that what we want?
Madam Chair, if I could, because I think
Yes.
Lindsay is accurately answering these questions. Elected officials are treated differently by state law than a salaried employee. This is a more complicated legal question that goes beyond what we can do locally with elected officials. I mean, basically the state law is looking at those that are incapacitated or those that have in fact abandoned their job. Elected officials are treated differently under state law. So we'd have to get a legal review of this, but I don't think the PA's office would find that we have the local authority to, if you have an unexcused absence for a week, you're not going to get paid for a week. I don't think we have that authority as an elected body.
Well, the constituent was talking about, and I must not have made that clear, extended periods of unexcused absences. So it's a little different from the 1 week reference that you just made. I think we need to consciously think about that because I believe that constituents do have a concern in that area.
So, Madam Chair,
Yes.
I think Councilor Medvey is correct on this, but it would be, Leslie wanted to weigh in later now. I don't believe that this local body has the authority to withhold pay from an elected official, whether they're excused or unexcused. But I'd be curious to get Leslie's input on that now or later.
Thank you, Chair Bowerman and Councilor Medvey and Councilor Olson. I can certainly look into that particular issue and get back to the council at a later date.
Thank you.
Happy to do that.
Thank you.
A second question that I had was regarding open public comment. If you would please scroll down to that. I believe it's up just a tad. Sorry, I don't have the number. Here we are, close. Is it L? M. So in M, in your opinion, it says the public should refrain from conduct, statements, or remarks that are uncivil, rude, vulgar, profane, or otherwise disruptive to conducting council business. Does that include defamatory remarks, particularly about those who are serving the county, whether as staff or as electeds?
Sure, I think that would constitute something that would be considered unrude, like uncivil, rude, or otherwise, disruptive to conducting council business. So I think that it would fall under that. If you want to add additional language to that effect, you can do that as well.
Madam Chair, I'm hoping this is still timely, but in the chat, someone just posted a reference, a URL to Pierce County's ethics code. And Lindsay, you had reviewed that code, had you not, from Pierce County?
Correct. Yeah, it's quite lengthy. But I did take, when drafting this initially in the Code of Ethics provision, did look to Pierce County as kind of an initial model. Of course, as I said, theirs is quite lengthy and detailed compared to what the council's ultimately looking at.
But right now we're looking simply at rules of procedure. So let's be sure we direct our attention back to that and keep the two separate as we ask the public to, ethics and the rules of procedure being different. I don't know in the just informal usage of the word uncivil in M exactly what that is intended to include, since it's not used there as a legal term, but as maybe just a descriptive one. Perhaps that does include defamatory language. I just I think want to be confident that that is included here, because that has been an issue from time to time.
I will also note, I mean, we follow Robert's Rules of Order, and that contains certainly language that derogatory, defamatory, or otherwise impugning the motives of the speaker. Those sorts of languages are not permitted, and is ultimately up to the chair of the meeting to then say we're not going to accept certain comments, similar to the comments that you made at the Board of Health earlier this morning. And so, I think this language would be sufficient, but again, if you want to add separate language, you can as well.
Chair, is your desire to add defamatory as one of the, shall not make remarks that are uncivil, defamatory, rude? Is that what you're asking to add?
I think I would feel more comfortable with that listed also, yes. Would you have an objection to that? No? Let's go ahead and add it. If Councilor Medvigi, do you have any objection to adding that? No, I see a negative.
No objection at all.
Okay, let's go ahead and add that along with uncivil, just to be specific. Is there any other comment from council? So this is already on next week's hearing agenda. You do not need an action from us today.
That is
I will get the
correct.
revised ordinance to staff, and we'll get the revised ordinance posted.
Very good. And so we'll be moving the revised one forward next week to hearing, correct?
Yes.
Okay, new business. Thank you so much for that revision and discussion. That was great. New business. 2.1 is COVID resolution.
So this resolution is something that I know Councilor Medvegy has mentioned before, which is a resolution regarding COVID-19. And I will note there's one change that would need to be made. Unfortunately, in the second whereas of saying that nearly 6 million globally, unfortunately, we have surpassed the 6 million global mark. So I would need to remove the word nearly. But otherwise, this just contains language regarding the pandemic, thanking the healthcare workers, and recommendations for everybody staying safe and hopefully healthy as we move forward in the coming months. So, I'll turn it over to Councilor Medvegy to talk more in detail.
If I could just provide a couple comments, Madam Chair.
Yes, please, Counselor.
So there's been a lot of misinformation about where the Board of Health, where this county council stands. What's been said by one or more. We've had calls by people to put in place mandates locally, and we have not. We've had calls from people to enforce mandates, which obviously the law is the law, and different entities are responsible, from LNI to the sheriff, you name it, as to different levels of where any enforcement would be. This doesn't get to any of that issue, other than to clarify the record, and hopefully it's still timely, where we stand as a county council and as a Board of Health in support of health best practices, which pretty much have remained unchanged from the beginning of the pandemic to today. So that aspect of this resolution addresses that. We're restating what the best evidence, medical evidence from around the world, is stating our best health practices in support of what our health department has been saying during these Board of Health proceedings. So I think it's important to clarify the record and restate those best healthcare practices, despite the belief of others in somewhat of a fringe belief that none of those practices are trustworthy. The other aspect of this is, it has been a hard pull for our healthcare providers and all those engaged, whether they work in our hospitals, work in public health, whether they do the cleaning there, treat patients as nurses, physician's assistant, nurse practitioners, doctors, surgeons, you name it. Every single person that drives an ambulance and that works in our healthcare system has been on the front lines of this, and sometimes with a lot of angry response by people. And so this is to thank them for all that they've gone through and for their continuing efforts. We're not completely out of the woods yet. And so this does try to capture where we are today as mandates are about to be lifted, not across the board, but in most public places they will be. This is kind of a slice in time today to thank them, but also to restate healthcare best practices. Thank you.
Would you please scroll down to the recommendations? And Dr. Melnick, I'm going to ask you a question about this in a moment. Down at the bottom there, where it says, be it further resolved as follows, near the 3 recommendations, are there any of those 3 that need to be updated at this time, or a 4th added, or any changes that you see?
I think, first of all, I do want to give you my words of appreciation for bringing this forward, because it'll mean a lot to all the healthcare workers and staff. So I appreciate that. I think I'm happy with the 3 statements there. They work for me.
Okay, thank you. And can we have a motion to pass this today?
I'll make a
Kathleen?
motion to pass it.
Okay, second.
Third,
Further discussion?
yeah, Chair, I would agree with Councilor Medvedee's points, and thank you for continuing to push this. I would have, it's long overdue from us, but it says a lot, and I think it's meaningful, and I appreciate the efforts to get it out in front of us so that we can adopt it, and to Councilor Medvedee's point, to be clear to the community where the Board of Health and where the Clark County Council stands on efforts to deal with COVID in the past, our healthcare workers, and then what we're going to continue to do in the future, because things are loosening, things are getting better, but we're not done yet. And so it's an important statement, and I'm glad we're taking the action today.
It has been moved and seconded to pass the COVID resolution. All those in favor signify by saying aye.
Aye.
Aye. There are none opposed. I could see all three of us saying yes. So the motion is passed, and thank you very much. And let's give this some good distribution so that the stance is known. Public health, or I'm not sorry, not public health, Public Safety Telecommunications Week proclamation is next on our agenda.
So the question for the council here is whether you want to move this forward to a Tuesday meeting. It would need to be on April 5th because the National Public Safety Telecommunicators Week is coming up in the first part of April. So this is recognition of the 911 dispatchers and the work that they do for our community and emergency services.
Comments from council? I see one thumbs up. Is there another thumbs up, Councilor Medvedee?
Yeah, I'm sorry. I thought you were looking for comments. I didn't have any comments, but I do have a thumbs up.
Okay, great. So as is my thumb being up, so this would move to a Tuesday agenda in that event. Thank you. Ukraine statement. I don't believe we had a draft of a Ukraine statement that was before us. I know that I am certainly an advocate for having a statement come from the county or council. We know that we have so many former Ukrainian residents and others with families who are still in the Ukraine. And there are Ukrainian refugees that are coming to Clark County. I don't know in what numbers, but they are coming. And as a consequence, having a statement is, I think, a very important stance to take. What is it that you envision from us today?
I think any language that you would want to include in there, I'm happy to look at, of course, other models that have been done and incorporate an updated statement regarding, standing with those in Ukraine and condemning the actions of the Russian invasion and, extending our support for the Ukrainians that currently, live in Clark County and that may be coming as refugees to Clark County. I know Lutheran Community Services is working with some Ukrainian refugees already and anticipate more coming. And there may be other agencies that are working locally as well that I'm not aware of. I'm happy to put together a statement and bring it back to council time next week.
Chair?
Yes, Councilor Olson.
Maybe, I don't know that, I think it's important that we get something out. And I would be comfortable, and I don't know, Councilor Medvedeee, can speak for yourself. I would be comfortable with you putting something out on behalf of the council so that we can get something out sooner rather than later, rather than waiting another week or, it's clearly up to the council, but I would be okay with getting something out that you're comfortable with. And so we can get a statement out into the public. But either way is okay with me, but I think sooner rather than later.
Thank you, Councilor Olson. Let's decide on that in a moment. I would like to see some quantification of the numbers of Ukrainians in our population, if that is known. And I don't know, but I would suspect that Pastor Paul Demyanik from the Ukrainian Baptist Church might be able to tell us where to get those data accurately. Are there other contents that you would like to see in the statement? Either Counselor Olson or Medvigi.
So I haven't seen a draft at all, and I'm certainly in favor of us coming up with a statement and being mindful of, I mean, I worked at some level in national security and have a master's in national security, and it used to irk me when I saw local cities and communities and Hollywood, is that a comment on and Hollywood actors saying what are, what national security statements should be made? I want to be mindful of, we're a small county and we should say the right things. We also have a population of Russians. My family itself is from Ukraine. And a lot of Ukrainians consider themselves Russians or Rus or other ethnic or cultural divisions. They're all one people. And the borders changed over times. It was Czechoslovakia, it was Hungary for a while, it was Poland for a while, and it was Russia for a while, depending on where the border was. So I want to have a helpful statement and clearly state that we really want this to end. These hostilities need to end. And it's not going to end just with Ukraine. If Ukraine is taken over, each former satellite is in jeopardy. Europe is in jeopardy. So no, Clark County doesn't make national security for our president, but we should be careful in what we say, and we should express our hope and prayers that this ends today, and that Ukraine is preserved. So I'd like to see a draft, and I trust the chair. If you come up with something and you want to get it out soon, like Councilor Olson mentioned, that would be great. But I would like to see a draft, and I'm hoping it just doesn't say more than it should.
Chair, you're muted. Chair Bowerman, you're muted.
I'm sorry, I was still trying to mute the dog, not me. Thank you, Counselor Olson, for suggesting that we certainly expedite this, and that we shall do, even if it means that we would have a draft that would be circulated in accord with what Counselor Medvigi has said, and with which I concur. Are there other comments?
So
Thank you for having this on the agenda.
So just for clarification, council's okay with us drafting the letter and have it go out under the chair's name in order to get it out before the next meeting with the council?
We'll see after I take a look at it if that is okay. Councilor Medvigi would like to see a draft. From courtesy, we'll extend the same to Counselor Olson. That could be a quick process, though.
Yeah, so council can certainly provide feedback. We just can't have votes on it. So we'll get the feedback from all the councilors and then send it to Chair Bowerman for your consideration to send out under your name. So thank you.
Very good. Thank you. Further comments? Okay, moving along to councilor reports. Counselor Olson, do you have any today?
I do not have any updates today. Thank you.
Okay, Counselor Medvigi.
So two quick updates. One, the RTC is moving forward and considering in the future how to work into its work schedule, planning for a third quarter. Those discussions are happening both in the executive committee as well as the RTC as a whole, as I-5 replacement bridge moves forward. So that's happening. Additionally, we had our first real initial meeting of ECHO, and I think it was very well attended, and there was really good discussion. So I'm hopeful that that entity will be value added to a collaborative effort across the entire county, and a number of those smaller cities have joined in as well. So the first meeting I thought was very productive and contained a lot of good discussion on how to move forward, because we really do have an opportunity to impact homelessness in the county over the next couple of years, doing some things differently. So that's what we're working on, from mental health to drug addiction to cleaning up some of these encampments that are very unhealthy and in very unsafe locations, but also providing shelter and a healthier, safe place to live. So this is a collaborative effort, and it's really just had its first session after both the cities and the county adopted its most recent MOU. So I'm optimistic that we're going to make good progress.
Thank you. And just to follow up on your comment regarding RTC, I do have a meeting scheduled with the executive director of RTC so that he could offer insights to me on behalf of council, so that I can share these with staff and council for how we could best proceed from a policy perspective with regard to the third corridor. You may recall that way back years ago, was it 2006, that RTC had an excellent study on the third corridor. I'm not sure of the year, that was paid for by the state. And who knows, maybe having an extension of that study, an update of that study might be something good to have as a base for further policy considerations. But anyway, if council has any input for that discussion that I'll be having with the executive director, I would certainly be delighted to receive it from you. Any further comments? If not, we turn to work session requests. And it looks like we have one regarding the DEEB annual report before us.
Yes, that's correct, Council. So the DEEB, which is the Development and Engineering Advisory Board, they come to the Council annually to provide their annual report for the prior year's work, as well as present their work plan moving forward. So they are requesting about an hour and a half at the end of March. Of course, staff will look at calendars to make sure we've got that time available. And again, it's to get feedback and approval of their work plan items moving forward.
Hour and a half is an extensive period. So does council have any comments on having this this work session? It's a go. So we are looking for when that will be scheduled. And do you have a possible date on that, Kathleen?
What they're requesting is March 30th. But once
would that work?
Staff always looks at the calendar once council approves the work session request. So I can't say for certain, but I'm sure we can work something within a week or two of that.
Okay. Lindsay, policy issues.
Nothing further for me today.
Very good. Given how the session has come to a close, I'm sure we'll be hearing more from you very soon, however. So
Yes, signing dies tomorrow, and we should be getting the budgets out today. So we'll some of them have been trickling out, and we'll get the final budgets out, and we'll have the analysis for you in the next coming days.
well, there are no further matters for before council time at this point. After executive session, which should take about 35 minutes, we will be back to put council time aside for the rest of the day. But for right now, we move into one pending litigation authorized by RCW 42.30.110(1)(I) for 10 minutes, and another pending litigation supported by the same RCW for 25 minutes. Council will be present for both, And let's see, it is 10:33. So would it be 11:10? We would be back. No, that's not right.
Chair Bowerman, if I can, I'm
Yes.
going to make it probably a little bit more difficult. First, I would like to ask the council to add 10 minutes for collective bargaining for our executive session. So the total executive session time would be 45 minutes with no anticipated action, and legal counsel will be present.
So 45 minutes. Why is it that when you're in this position, you can't add 45 minutes to 10:34? We should return at least by what, 11:16?
11:20,
Thereabouts?
if I did it right, 11:25.
11:25? Okay, thank you. I hope that's correct. And we will return to council time at that point with no action taken at that time. The meeting is moving over to executive session at this time. Thank you.
Please note that the council is extending to 10 more minutes, and we'll be back at 11:35. Thank you. Attention, please. The council is extending their executive sessions for 5 more minutes until about 11:40. Thank you.
We have a quorum present. We have completed the executive session. We're back in council time on March 9, and council time is now adjourned.